Hello, my name is Kona. I am the Director of Communications at Disability Rights Montana.
And I'm Christa. I am the Director of Public Policy here at Disability Rights Montana.
And we wanted to take some time today to talk about the Montana Medicaid situation with all the changes folks are having, people losing coverage, and everything kind of around that.
Well, the first thing that comes to mind and the first thing that jumps out is just the sheer scale of the unwinding.
Over 130,000 Montanans losing Medicaid. That's wild. That is, we just have about 1.1 million people in our state. So that's a large part of our population.
Yeah, 130,000 is no joke. And unwinding, that sounds a little too gentle for the kind of impact that it's having. Don't you think?
Yes, I agree. And this isn't just a Montana thing.
No, not at all. And it's important to remember that Medicaid is a partnership between states and federal government. So when federal policies or funding change, it has a ripple effect. So Montana has to be able to adjust its own programs accordingly.
Which brings us to something I find really interesting. Medicaid isn't just one thing.
Right.
There are distinctions between state plan Medicaid, which sounds like your typical health insurance, and then you have these Montana-specific waivers.
Yeah, and those waivers are where things get really interesting, but also a lot more complicated. The state gives some leeway to Montana to tailor the Medicaid programs, but that flexibility creates a whole nother set of hurdles for vulnerable Montanans.
And there are three main waiver programs in Montana. One for people with developmental disabilities, the Big Sky waiver for seniors and those with physical disabilities, and then the severe and disabling mental illness waiver, which we typically refer to as the SDMI waiver.
Right. And each one of those waivers has its own specific requirements and hoops for folks to jump through. So, for example, to qualify for the Big Sky waiver, you don't just have to meet certain financial criteria, but you also have to prove that you need a certain level of care, which is it isn't an easy thing for some people to do. And it's partly how people are getting lost in the shuffle.
And the state doesn't make it easy to get those benefits. I mean, we've heard a lot of stories about really long wait times after waiting for so long and filling out paperwork, people being denied again.
Yeah. We're not just talking about bureaucratic inefficiencies here. These are systemic barriers. Montana has some of the lowest reimbursement rates for Medicaid providers in the country. And now the state has tried to make efforts to improve this, but it's just not enough. And
all this just makes me wonder how much bigger or more complex is this story?
Well, it is. Medicaid isn't just about individual well-being. It's tied into Montana's overall economic health.
And it's been reported by the Montana Healthcare Foundation that 76% of people on Medicaid in Montana are either working or going to school. And that number really challenges this stereotype of Medicaid just being a handout.
Right. And it should. These are folks that are contributing to their communities, and Medicaid is there to help them stay healthy so that they continue to work and go to school. And it's not about how much the state spends. It's about using those federal funds in a smart way that benefits Montana's economy as a whole.
And that makes sense. If you don't have healthy employees, you may not have a healthy business. There's also the state budget itself, something about how Medicaid actually brings in more money from the feds. Is that?
Yeah, that's a key part of the conversation. Hospitals, which are often major employers of in some of these rural areas. So a lot of their funding comes through Medicaid.
So we've got this whole economic part of the conversation, but we also need to talk about this. There's a moral aspect of this, right?
Yeah, totally. Access to healthcare is about more than just the dollars and the cents. At the end of the day, it's about dignity. It's about making sure that everybody has a chance to a healthy life, no matter how much money they make.
And so speaking of making sure everyone has access, this certainly impacts tribal communities in a fairly unique way.
Absolutely. And this is where those ideas of access and equity really hit home. Medicaid has been a game changer for IHS facilities.
And for folks who may not know, IHS, that's the Indian Health Service, right?
Yeah. And because federal government is obligated by treaty to provide healthcare in Indian country, they actually cover 100% of the costs for Medicaid at those Indian health services, at those Indian health service centers. So that means those IHS centers can do a lot more than just handle life and death situations. They can focus on preventative care, which has a huge impact on the long-term health.
So it's not just about treating the problem after it starts, it's about stopping it before it even becomes a problem.
Yeah, well, that and shifting towards a preventative care model with Medicaid could actually save money down the line.
Which is a good example of how these decisions about policy don't happen in isolation. I mean, whatever happens with the Medicaid program in Montana has ripple effects across our entire state.
Right. And we can't lose sight of the human element. Some people have had to put off having kids. Some have had to move in with other family members because they've lost coverage or they couldn't afford the care that they needed.
And so, I mean, healthcare just shouldn't be a political issue. I mean, we're talking about real lives of real people and their well-being.
Exactly. And it gets to a bigger question. How do we balance being responsible with money and our responsibility to one another?
And that's such a great question, right? I mean, that's the $1 million question. Well, hopefully this gives folks a good foundation for understanding the conversation around Medicaid, because it's not going away anytime soon.
No, it's not over. In fact, as we enter into the next legislative session, as you hear the different points of views about whether or not we should continue to invest in Montana's current Medicaid program, just remember what we've talked about today. Think about the compromises, the long-term effects, and most importantly, think about the impact this has on real people in our communities.
Absolutely. And if you or someone you care about has benefited from the current Medicaid program, we want to hear your story. Real experiences help show just how important Medicaid is for our communities.
Yeah, and if you're willing to share, please contact us by calling our office at 406-449-2344 and ask for Kona. And your stories could make a difference in protecting and strengthening Montana's Medicaid program.
Well, thank you, Christa, for being here.
Yeah, thank you. And you're welcome.
To everyone listening out there, keep asking those tough questions, keep looking for honest information, and let's keep this conversation going.